Good afternoon, dear ladies and gentlemen. I'm very glad to be here with you. I do wish I were there in person, but hopefully better days are yet to come. I'm delighted to join the discussion on fighting the last war. I don't like wars, but I realize that very often fighting for the principles, for something we believe in, we have to enter all kinds of wars. And whether we win it or lose it, that depends on us, and to a large extent on our personal or professional journeys, the one that we choose. When I think of mine, I realize I always wanted my journey to be meaningful, to have an impact, to make the world more prosperous, more successful, and people's lives more easier, joyful, longer, and healthier. In my teen years, I wanted to become a surgeon. I really was determined to do that. I wanted to go some hard places, maybe war zones, to help people, save their lives. But sadly, that was not meant to happen. Before that, when I was 4 or 5 years old, I had a wonderful dream of becoming a princess. But sadly, that didn't work out either. So I decided to focus on something more meaningful, something very important and rewarding. And that is advancing public health, specifically advocating for tobacco control, because smoking-related diseases and deaths can be and should be prevented. That means that we could change the grim reality around us. And if we can change it, then why don't we? By the way, I don't think I left tobacco control. I think that right now I'm actually in the real tobacco control, the one that is about saving lives, because it's focusing on the harm reduction strategy. And this strategy is about saving lives, providing healthier choices. What is the real tobacco control about? It's about actions we have to take to fight cardiovascular diseases, to prevent cancers. That would mean saving lives. We all know that 8 million people worldwide die annually of tobacco-related diseases. In Ukraine, this number is 85,000. In the Russian Federation, every year, 320,000 people prematurely die of tobacco-related diseases. In fact, in Russia, 18% of all deaths are caused by smoking combustible cigarettes. Now, who are all these people who die today? They are the adult smokers who would love to quit, but cannot, because they're not provided professional assistance or proper guidance. These are chain smokers who are addicted and cannot quit, using only their willpower, because they do not know of healthier options. There is no objective information or unbiased full information, especially in this part of the world. A couple of months ago, my great friend almost died, 40 years old. He had a stroke. He's been a chain smoker for 20 years. You cannot imagine how many times he tried to quit and how many times he failed, because he had no idea, no clue about healthier options on harm reduction products that were around him. He was trying to get help, but he could not get it. Luckily, he made it. He is alive. But that made me think of other chain smokers, like my friend, who were not that lucky, who did not make it. How many of them would not make it today, would not make it tomorrow? That means we have to raise the level of ambitions in tackling tobacco-related diseases. This is what the real tobacco control should be about. And we all should be more passionate about that. Yes, we do know that resources in low middle income countries are stretched. We do realize that countries with weak legislative system, with weak enforcement system, are not that successful in helping adult smokers quit. But still, the reality, when the whole approach to tackling that tobacco epidemic is based on the victim blaming principles, when smokers are neglected, stigmatized, that has to be changed. This whole reality is the one that should not be accepted. For instance, a few months ago, our organization did a survey in Ukraine aiming to see how many adult smokers actually today are willing to quit and try to quit. The results were quite encouraging. Turned out that almost half of the respondents did try quitting over the past year, but 0% of those optimists actually could get professional guidance or medical assistance while trying to quit. Now, how depressive is that? And yet, I don't see WHO or here talking loudly about this issue. I don't notice any tobacco control groups expressing their deep concern about this matter either. And no one can solve the problem simply by ignoring it. One has to act. It's true that WHO has done a lot to prevent kids from smoking in the past, having implemented a number of WHO FCTC measures. And I personally have contributed to that over many years in many countries. This is very good. However, that doesn't mean that one should become manipulative about this issue. We all understand that when we talk about kids' lives and health, this all is very emotional. However, let's try to say a little bit beyond this matter. If it would take up to 40 years from now, if all of a sudden all kids today stop smoking, 40 years, that's a lot. However, if we really want to tackle cancer, cardiovascular diseases, let's say in a feasible future, 10 years from now, we have to focus on smokers today, those who need help now, providing them with all possible resources available so they can quit. And these resources, as we all understand, are right here. However, instead, I find myself in a very strange reality of twisted facts, massive disinformation campaign about harm reduction products, when the focus has been completely shifted from the real tobacco control. Sadly, it's no longer about saving lives, nor it is about tackling smoking as a #1 risk factor for non-communicable diseases. It's purely about attacking harm reduction products. This is not what the real tobacco control should be about. And this reality should not be accepted. It must be addressed with a new reality, completely different, where smokers are respected and not stigmatized, where they are cared for and provided help by their doctors, where economic incentives to help smokers switch to harm reduction products and quit are available, where governments of all countries care and healthcare workers actively provide professional guidance. The tobacco control I used to be a part of, unfortunately, does not exist anymore. It has stepped away from science, from world best practice, and is now based on one single cliche used for all countries, based on demonizing harm reduction products, equalizing them in every possible form and shape with combustible cigarettes, telling lies. And that happens in every country, presenting harm reduction products as a Trojan horse, undermining the tobacco control efforts. This is happening now, today, when science is clearly telling us that, on the contrary, harm reduction products are should be promoted as an effective way to combat smoking, to win users away from smoking combustible cigarettes, and thus opening a way for them towards a better future, creating opportunities for making healthier choices. And I think this is exactly what we should focus on if we want to win this war, and nothing should discourage us. That won't be easy, but I'm sure we all can meet the challenge and win. Thank you very much for your attention.
Thank you.